All right, so let's go over one more. I'm not sure if any of you were in this discussion before because this question did come up, but it's a very common question. So this is about, we know that doctors are not really supposed to have relationships with their patients, right? And we were discussing that psychiatrists are never allowed to have a relationship with their patient, never, ever. A medical doctor, other specialties, technically they can have a relationship, but they have to cut off all doctor-patient communication or cut off any doctor-patient relationship. If they and then after a certain time period, they may date or have a relationship with a former patient. But it is always a tricky question and a tricky subject, and people have been fired. Licenses have been lost when doctors have had a relationship with a patient, and it's considered immoral and unethical for clinicians to have emotional relationships with their patients. Has this question come up?
I got one question regarding this. If one patient in your clinic asks you on a date, then what you will do?
Good question. Good question. Anybody else? It seems only he has interviews so far. So anybody else?
No,
Yes,
maybe
Dr.
they
Khan.
looked at him and they were like, "Yeah, this guy's gonna get asked out a lot." So
Maybe he's handsome and dashing. I don't know. Huh? Okay. More handsome and
Yeah,
dashing than
I'm just
anybody else, huh?
I'm sharing the information, right? Like, so
Okay. There actually, we'll talk more about this because there are many different aspects of this question. And we need to know that you cannot have a relationship with a patient.
Dr. Amar, I have a question, please.
Sure.
Yeah, if somebody asks and they're like, "What would you do?" Do we predominantly mention the fact that we would be very kind to our patient regardless of whether they ask us out or not?
Yeah, I mean, you would be kind. That's yeah, you could say that. It's not that you cannot say that, but I don't think you need to say that in this question. That you will be kind. Um, that goes regardless of the situation. You need to be kind nonetheless with any situation.
So we just say we'd tell them sternly that this is not professional for us and we can't really embark on a relationship with our patients.
Exactly, that's definitely part of it.
Okay.
Exactly. And we'll address both these questions. So beginning with, if you saw a senior being involved in a relationship with a patient, how would you look to address that? So again, this is about ethical standards of the medical profession, and we have to definitely know about this. So if I found a senior, and the thing here is, so the thing you need to keep in mind is that nowadays it's very few people are in private practice. So if you get in trouble, you can handle it yourself, or you may not fire yourself, right? But nowadays, very few people are in private practice. I think 70% of the doctors, even more, are employed. That basically means that you can be fired by your employer. There's a guy, MBA guy, sitting on top who can fire you. And if there's an investigation, so investigation goes everywhere. When there's an investigation, everybody gets investigated. You have to keep that in mind. And the way you would answer the question, let's say you are a junior or anybody else or a colleague. So if I found a senior doctor was involved in a relationship with the patient, I do recognize that is a very serious ethical violation, and we have to definitely maintain professional boundaries. And this is all in line with protecting the patient. We cannot have any emotionality happening while treating a patient. And I will look to discreetly confirm and observe the situation. I will not jump to conclusions. If I see something that is very concerning, then I would convey the matter to the hospital's ethics committee, or follow any institutional steps that they have in place for reporting these incidences. Yes, I do believe we have to maintain professional boundaries. I respect my colleagues. I would have respect for my seniors, but I definitely believe that this sort of situation cannot be happening. And I will let the ethics department or anybody else, take it from there, and they can evaluate. I would look to avoid confronting the individual myself. I think this is something that's much beyond myself, and it relates to patient care and patient well-being. I would proceed with this situation as such. Okay. So a lot of people would say that, hey, why don't you talk to the colleague to cut that? Hey, can you stop this from happening? Can you not date your whatever, he or she, right? That could be in a way, okay, he's your friend, he's your, you know him or her, and you don't want them to make this mistake, or you just keep quiet. But let's say in the future something bad happens and they break up, right? And that person, that patient knows that, hey, this was illegal. He should not have dated me. He or she should not have had a relationship with me, right? That person, to get back at the person, may complain to the hospital. Hey, we had a relationship. now that we are fighting, we had a relationship. So that will be a big concern. And when the investigation opens up, they found out, oh, you also knew that. He or she was actually having the relationship, but you also knew that, and you didn't bring it up. So he or she is going to get in trouble, but you're also going to get in trouble because you knew it. You see? Comprende? Spanish for understand? Yes, no, maybe so?
Yeah, Dr. Umar.
Right.
It's pretty clear. Don't do it.
So your point about that if a patient is approaching you and is showing their intentions, definitely, as Abdullah, you had mentioned that you will be very professional and say that this is definitely not allowed, and we are in a professional environment, and you're my patient and I will deal with you as such. So that is definitely how you would say it. Depends how much the patient is approaching you. What you would do for any future situation, any future visits, is that you would have a chaperone in your visit, in the office. Okay. You will have a chaperone, and you will always convey that you would need to have a professional boundary. That's it, and you will have a chaperone with you. The way they ask this type of question is, that's one. The other way they can say is that if you suspect that the patient is coming into your clinic making complaints that are not really medically objective complaints, and they are just talking more and being more affectionate and saying nice words to you, if you suspect anything like that, even if the patient is not overtly communicating to you about their feelings, if you suspect something, you would again have a chaperone at all times.
No, I get that. That's perfect.
Right? Okay. Chaperone at all times. Any questions regarding this?
Yes,
Anybody
Dr. Khan, I have a question.
Situations like this. How do you handle it?
Can you hear me, Dr. Khan? I have a question about this.
Sure, yes, Faisal.
When you say that if a situation like this arises, do we have a chaperone in the US when we go and see a female patient from the start? Do we not have a chaperone?
So it depends. So if it's a regular visit, and you're not evaluating the private parts, no, you don't need a chaperone. If it's a regular visit, you're not evaluating the private parts, you don't need a chaperone. With any evaluation of the private parts, you need a chaperone, male, female, both. More with female.
Mm-hmm.
And chaperone basically means you can have anybody. You can have the nurse or anybody else, just a second person to be there to witness.
They have to be female, right, Dr. Umar? They can't just...
Yeah, female. Yeah, female.
Right, Dr. Umar. That makes sense. Thank you.